Hello, my name is Ivar Eide. I am a consultant doctor at Akershus University Hospital. This information video about coronavirus, COVID-19 and the corona pandemic is tailored for transplant recipients and persons with chronic kidney disease. It is a collaboration between the Norwegian National Association for Kidney Patients and Organ Transplant Recipients, shortened LNT, and Akershus University Hospital. The project has received financial support from the Dam Foundation. There is an abundance of information about the coronavirus. It may become overwhelming and we risk losing interest. At the same time, there is scarcely any information about COVID-19 targeted for transplant recipients or persons with kidney disease. And some of our patients report that they struggle to find relevant information on COVID-19 in their preferred language. Therefore, LNT has made 4 information videos on COVID-19 tailored for transplant recipients and persons with chronic kidney disease, which is made available on their website lnt.no and on YouTube. Google LNT. Click on the coronavirus image and select a video. One video provides general information on COVID-19. One video is tailored for persons with kidney disease, and one video is tailored for transplant recipients. In addition, one video shows where to find reliable information on COVID-19 in several languages on the internet. The video you are watching right now is simply a short summary of these 4 videos. The coronavirus attacks the upper and lower airways and can spread throughout the body. It travels between humans through droplets containing virus. When an infected individual coughs, virus droplets are dispersed in the air and may hit someone nearby and enter their body through their mouth, nose, or eyes and cause infection in that person. In rare cases, the virus may spread through contaminated surfaces. That is, when someone touches a virus-contaminated surface and thereafter touches their own face. The virus droplets do not travel long distances. Most droplets fall to the ground within 1 meter, and if you keep a 2-meter distance, there is little risk of catching the virus. You should wear a face mask when close contact with others cannot be avoided, like for instance on the bus. The National Health Authorities recommend several infection control measures, which can be found on their websites, or you may visit the website sanitetskvinne.no that sum up these infection control measures in several languages. Google Sanitetskvinne, click on the tab Om Corona, that is about coronavirus. Click on information videos in several languages and choose a video in your preferred language. The virus capsule contains spike proteins that enable it to bind surface proteins on human cells. Without the spike protein, the virus cannot attach to and enter our cells and do damage. Antibodies targeted against the spike protein prevent virus attachment to human surface proteins. Vaccines stimulate our body to produce these antibodies and thereby preventing a virus attack. Mutant variants of the coronavirus contain small alterations of the spike protein that enables the virus to bind stronger to our surface proteins. Thus, the mutant virus variants are more contagious and also causes serious infections more often. Antibodies produced following vaccination do not bind the mutant part of the spike protein, but it can bind to several other places on the spike protein and therefore still be effective in fighting the virus. During the first few months of the pandemic, where we only had the original coronavirus, a person with COVID-19 would be expected to infect 2 other persons on average. Number of cases increased quite steadily. After the introduction of strict infection control measures in Norway, we managed to stop the spread so that 1 person with COVID-19 infected 1 or less person on average. The more contagious mutated coronavirus variant has recently become prevalent in Norway. If we do not adhere to infection control measures, a person with COVID-19 from the mutated virus is expected to infect 3 or more persons on average, and number of cases will increase rapidly. With the current strict infection control measures, the spread of infection was reduced somewhat, but it has not been enough to prevent a rise in number of cases. The Norwegian health authorities have made a vaccination plan for the population with priority groups. By the end of March, vaccination of elderly persons in priority groups 1, 2, and 3 should be nearly completed, and we can start vaccination in group 4, that is, people from 65 through 74 years, plus all adults belonging to a Covid-19 high-risk group. Transplant recipients and persons with chronic kidney disease are both considered a high-risk group. If your municipality has not scheduled you for vaccination by mid-May, we recommend that you contact your local GP to make sure that you are listed as part of Group 4. Several vaccines targeted against the coronavirus have been developed. In Norway, we currently use the RNA vaccines from Pfizer and Moderna. They are given as 2 doses at 3 to 4 week intervals and have been shown to be safe, and they are most effective. Until recently, we also used the AstraZeneca vaccine in Norway, but it has been temporarily stopped due to rare cases of thrombotic disease after vaccination. The risk of Covid-19 without vaccination is quite high, so many countries have started vaccination with the AstraZeneca vaccine again, despite this concern, at least for selected groups. RNA vaccines are offered until we are sure that the AstraZeneca vaccine is safe. There are several other vaccines currently available, but we do not know yet which of these that will come to Norway. Information about the Norwegian vaccination program in several languages is available at the Norwegian Institute of Public Health website fhi.no. Google FHI, click on the coronavirus page, click on the tab Communication Measures and Information in several languages. Here you may find a lot of relevant information. For information on vaccines, click the bottom line and select a written or oral presentation in the language you prefer. This graph shows the risk of death from COVID-19. Age is the most important mortality risk factor. Compared to a healthy person of the same age, a person with advanced kidney disease has a 2.5 times high risk, and a transplant recipient has a 3.5 times high risk of death due to COVID-19. If you become ill, or else if you suspect that you have been infected with the coronavirus, you should schedule an appointment at your local test station to take a coronavirus test. You should avoid contact with others until you have the test result. If you become really ill from COVID-19, do not hesitate to make contact with your GP or other healthcare providers, because in severe COVID-19, some of your regular medication may be paused, some persons may need oxygen supply, and some may even need assisted ventilation. We are concerned about the mutant coronavirus variants that cause a steady increase in cases and a more aggressive disease. The World Health Organization website shows that more than 120 million people have been diagnosed with COVID-19 and that 2.6 million have died from the infection. Compared with most other countries, Norway has experienced few cases of COVID-19, with 82,000 cases so far and 648 deaths. COVID-19 is prevalent in many countries, causing serious illness and deaths, filling up hospitals and necessitating long-term closure of the society. In the US, 9% of the population has already suffered COVID-19 and 0.16% have died from the disease, which means that about 2% of cases die from the infection. Similar figures are shown in our neighboring country, Sweden. So far, the situation in Norway has been better, with 1.5% diagnosed with COVID-19 and 0.01% deaths from COVID-19. That is, less than 1% of infected persons die from this disease here in Norway. However, number of cases is increasing in Norway due to the mutated virus variants. If many become ill and hospitalized at the same time, the proportion of persons who will die from COVID-19 will likely increase. We have also noticed that more young adults suffer severe COVID-19 with the mutated variants compared with the original coronavirus. It is therefore extremely important that we adhere to infection control advice, stay up to date, and take the vaccine when offered. If we all work together, we can fight this pandemic. Thank you for listening.